Rehabilitation after ACL surgery is really important, and so in this video we're going to show you guys how to get off to a great start. Hey everyone, welcome back. I've brought a couple therapists with me today. This is Kyle, this is Brandon, and in this video we're going to go over some early ACL range of motion exercises that is geared towards patients who are within somewhere around the first 2 weeks after ACL surgery, and hopefully this will give everybody some exercises that they can get started on so they can go ahead and start working on regaining their early range of motion and getting a good start to their rehabilitation. The exercises that we will be going over include heel props for knee extension, heel slides to assist with knee flexion, as well as assisted heel slides, ankle pumps, quadriceps sets, or quad sets for short, and patella mobilizations.
One of the most important parts of your ACL surgery is going to be restoring your range of motion. One of the most important parts of that is actually extension or straightening of the knee. So what you're going to do is take either a towel roll or whatever you have at home. You're going to lift up your heel and prop it up. That way there's space underneath the knee and whatever surface you're lying on, and you're just going to let gravity work and slowly straighten your knee over time. You can do this several times throughout the day. In addition to gravity, you can also take your hand and you're going to place it above your kneecap on this muscle on the front of your thigh and slowly press down until you feel a slight stretch on the back of your kneecap. Again, you can continue with this exercise multiple times throughout the day. Another important exercise for your ACL and restoring range of motion is going to be heel slides. This is going to improve your knee flexion. What you're going to do is take whatever you have at home, whether it's a towel, sheet, or ACE wrap. You're going to put it around your ankle, cross it over, and you can grab it with your arms. And what you're going to do is use your arms to assist your knee in bending up until you feel a light stretch. You're going to hold that stretch for 15 to 30 seconds and then slowly lower it back down. This can be done sitting up or lying down. If you're having a little trouble with the heel slides and need some assistance from a family member, this is how you're going to proceed. So have the family member get right here on the ankle. Make sure the knee is nice and straight. Have one arm cupped under the knee and the other arm slowly pushing up the heel, making sure that the knee is bending upward in a nice straight motion. Family member, you're going to go until the patient tells you that they're feeling a stretch in the knee. Again, holding it there for a couple seconds and then slowly lowering it back down. Again, nice and straight. With this exercise, most of your pressure is going to be in your whichever hand you're using under the heel. The other arm that you're using to support the knee is just going to be there in order to keep it straight. Again, when you're pressing up, we're using most of the pressure through this arm to slowly drive the knee upwards. This arm is just here to prevent the knee from going side to side. Just kind of gently holding the calf here. And then same thing on the way down, we're using most of the force through this arm in order to just slowly allow this leg to straighten back out. So to further elaborate, when you're bringing the leg up, you're using this hand right here to prevent the knee from falling outward or falling inward. We're trying to keep this kneecap pointed straight up towards the ceiling, which means the knee is straight when we're bending it. Again, we're using most of our force through our arm down here that's around the heel to actually drive the knee up and down with this leg here, just to prevent the knee from moving side to side. Another important part of your ACL rehab is going to be restoring strength to the quadricep, or the muscle on the front of the upper leg here. So what we're going to do is what's called a quad set. So you're going to take your hand and you're going to put it under your knee, and you're going to actively try to flex this muscle in the front in order to press your knee downward into your hand. You'll know you're doing this correctly if you can feel the back of the knee pressing against your hand. Hold this exercise for 5 to 10 seconds and then relax. Another important exercise after your ACL surgery is going to be ankle pumps. This is going to help with swelling and circulation in your lower extremity. So what you're going to do is you're going to slowly pump your ankle up and down. Do this several times throughout the day. Another important exercise on your ACL rehab journey is going to be patellar mobilizations in order to improve kneecap mobility. So you're going to start by placing your hand on top of the kneecap, slightly putting down some pressure onto the kneecap and pushing it downward towards your ankle, and then allowing it to go back upward. You can do that several times, and then after that you're going to put your hands on the side of the kneecap and slowly apply some gentle force, moving your kneecap side to side.
Once again, here's the list of the exercises that we've just gone over, as well as some suggestions for sets, repetitions, and duration of the exercise. So hopefully after watching this video, you learned a few exercises that you can get started on early on after your ACL surgery to really get things off to a great start.